free mental health services. This is where I think the future needs to go. Dr. K here, ICU doc, and I just recently wrote a new book on how we solve our current healthcare woes, calling it opportunities in healthcare. And many of you have heard me say that I actually don't think we need to spend more money when it comes to our health. I think it needs to be put in the appropriate buckets. And in my humble opinion, we are underserving when it comes to the mental health side of things. So let me give you my perspective as an ICU doc. I routinely see patients, especially nowadays, people coming in with the overdoses, suicide attempts at all ages, especially our younger generation. And we know that males are 3 times as likely to actually pass from suicide attempts. We know illicit drug use is on the rise. I see the impact of mental health on chronic disease, where people don't feel that they have the capacity to rehabilitate. Their mood is down. We see the links with metabolic health and mental health concerns when it comes to depression, anxiety, bipolar, schizophrenia, all ties to metabolic health. And we know that's getting worse. So how do we get around this? Number one, as I mentioned out of the gate, we need to make access front and center. To be honest with you, this is one of the reasons I joined the group at MindStride. How do you democratize mental health? And not everyone needs to see an expert psychiatrist. Not everyone needs to be seeing a clinical psychologist, but access to clinical or to psychotherapy, get people out of that rut using techniques such as cognitive behavioral therapy to reduce the anxiety and depression, get them motivated, get them on the workforce. This is what we need. And this might seem daunting. In this Canadian system where we say free access and all these things, when I look at mental health, this is not separate from physical health. This is all part of the one puzzle. Because if you're not impacting people's mental health, if you're not trying to improve on that, the physical side is going to be impacted. As I mentioned, what we see in the intensive care unit. So improving access, this could be virtually, this could be hands-on, could be through doing more group sessions. It could be also being more proactive when it comes to people's mental health, especially our youth, when to ask for help, how to manage their stress and anxiety. We already see a little bit of this in schools where they're talking about mindfulness practices that they could implement to try and improve their current status. So we're moving in the right direction, but there's still tools that I think we have in front of us. Another one as an example, I got to interview Nick Fabiano, and he's a future psychiatrist. And he put me on the line that exercise for many patients is as good as being on antidepressants or anti-anxiety medication. You know how huge that is? You know how huge that is to be able to give people the agency to say, move your body and you're going to start feeling better. You're going to start moving in the right direction. And don't get me wrong, we know there's going to be people that are going to need more than just exercise, more than just lifestyle changes. But there's going to be many where this is going to be the ticket. This is going to be the tool that's going to allow them to improve their mental health. So encouraging that at an early age, promoting that amongst our youth, saying, hey guys and gals, you're not feeling as well as you can. Move your body. Go for that walk. Take that dog out for a walk. Go after that meal with your mom and dad. Go play outside with your siblings and your friends. Start that message early so that we can be ahead of the curve. Because honestly, if we're serious about the health of Canadians, this needs to be front and center. It needs to be. I think just to reinforce on the nutrition side, what is also magical is seeing how either going through ketogenic diets, low carb, these other methods that are improving people's metabolic health and also having that impact on their overall mental health, that's encouraging too. Once you see that the ability to take that ownership, have that agency, that's powerful. But all this to say, let's make this a priority. Those that are struggling, reach out for help. And I know, once again, a lot of people can't, especially in 2026, afford those services. But whether it's calling a friend, whether it's calling your sibling, your parent, or any of the helplines, we don't want to get, we've seen too many people succumb to mental health and take their own lives. And I just think we got to do everything we can to support them. It's a tough world right now. Economy, I think the amount of people attached to their phones and how that's impacting their mental health, the lack of social connections. I think this is all by design, unfortunately, like the way we've set up our culture now, this is what we're up against. So knowing that, don't be shy to ask for help. Don't be shy to reach out and get the help you need, because we want to see all of y'all thriving. Anyway, just a short little cut today. Hope this is helpful. And once again, any way we could help out, send a message. What's helped for you? For example, put it in the chat or DM me. What's helped for you when it comes to your mental health side of things? As for me, as an example, moving my body is key. Working out, hitting that gym, playing hockey, connecting with our friends, all of the above is magical. Anyway, thank you so much for listening. Connect again real soon. Peace.